Fox 3 is good.
I should know this.
That's right.
Yeah.
Fox 32.
And then, sorry. Well, should we end? Okay.
Excuse me.
Yeah.
Marco.
Okay, yeah, can you take me back this way? Do you still possibly have that cavity? No. Like one other strip. Yeah.
Hey.
Did you do a shot with us? Did you do your shot with the interpreter?
Yeah, I need to get the interpreter.
I don't know why I thought it was behind you.
Send you the picture, no extra charge to yourself.
Wow. Good.
Yep. Oh, is this yours?
Thanks. So, yeah. So, thanks.
are you? Did you see the skit they did of you on WTF?
I heard something happen.
I couldn't hear it, I just saw it. I know they're gonna find it too. Probably in the basement. I didn't hear it, I just saw it.
Oh.
It was a whole skit.
Hold on, let me see.
Good afternoon, everyone, and welcome to today's briefing on the status of COVID-19 in Illinois. To start, I'd like to turn it over to our IDPH Director, Dr. Ngozi Ezike, for today's medical update.
Thank you, Governor, and good afternoon, everyone. The number of cases statewide is generally trending upward, and positivity rates have increased throughout the state. Of course, more in some counties and regions than others. Many people may be thinking that the numbers aren't that bad, that we look better than many other states. They're better than what they were a few months ago, and that is true. They're not as high as they were in April and May, but they are increasing. And if we don't take further steps to reduce the spread of the virus, our numbers will continue to go up, and we will be right back where we were just a few months ago. Anyone who thinks that wearing a mask or keeping their distance doesn't help, you are just wrong. Both of those incredibly simple actions have been shown to slow the spread of the virus and decrease the number of cases. Let me just share one specific example. This was recently released in an article in a journal, and it was talking about two hairstylists that had COVID-19 that were on the job before they knew they were positive. They found out they were positive, so in contact tracing and trying to identify all the people that they exposed, there were 139 clients who these two hairstylists had interacted with while they were symptomatic or pre-symptomatic. But as it would be, the company's policy and the community's policy was that indoors people wear face coverings. And as a result, after testing and looking at all the people that were exposed, there were no secondary cases reported from clients that had been exposed to those hairstylists. And just in case you think that maybe they weren't really positive, but the stylist did happen to infect their spouse and their child and their child's partner. So I think this is great evidence that, in fact, these mitigation measures work, and I'm hoping that people will continue the uptake of face coverings as we proceed. Today, we are reporting that 1,759 people were newly diagnosed with COVID-19 for a total of 186,471 cases. Since yesterday, most regrettably, 30 additional individuals were reported to have lost their battle with COVID for a total of 7,573 lives lost. As of last night, 1,552 individuals were in the hospital, hospitalized with COVID. Of those, 368 individuals were in the intensive care unit, and 129 individuals were on ventilators. In the last 24 hours, 46,668 lab results have been reported for a total of 2,896,063 tests performed statewide since the beginning of this pandemic. Yes, we still need more testing, and yes, we have been working to increase the number of tests every single week. We also need more contact tracing, and we're working with local health departments to hire those people. But we also need more personal responsibility, more community responsibility. Events like the White Trash Bash, where hundreds of people gathered, are ways that the virus can spread if we're not masking and distancing. It can be the cause for increase of cases. And someone who's at the event could spread it to someone else, who could spread it to someone else, and so on. It doesn't matter what the type of event is. It could be big events in the community, sports tournaments, large gatherings for protests, family reunions. No one should be gathering in large groups where you can't keep 6 feet of distance and can't wear a mask. And this is not about trying to take away people's freedom. It's about stopping the spread of a deadly virus. COVID-19 is an invisible threat with very visible consequences. You're tired of hearing it. I'm tired of talking about it. Believe me, I want this over as much as everyone else. But this virus is not tired. In fact, it's trying to gain momentum. It's cunning and it's elusive. Some infected people have no symptoms at all, or very mild symptoms. I keep hearing from my contact tracers at the local health departments that they're hearing the same story over and over. I had no idea that I was positive. The symptoms I had, I thought were allergy symptoms. I never would have thought it was COVID. So please don't overlook those allergy-like symptoms. COVID can look like so many things. And please, I know we love our family, but just because it's family, don't think that it's necessarily okay to get together without masking and distancing. If your family members are not in your immediate household and they're not in your established bubble, please understand that you are exposing yourself and them to the additional risk of virus spread. We do have too many unfortunate examples also from the contact tracing of extended family gatherings turning into dozens of positive cases. Unfortunately, people even gathering for funerals and then going on to catch COVID in multiple people at that solemn event. I understand that there are things that can't be delayed or put off, but please use the mitigation strategies available to put ourselves in the best possible situation. I also really want to focus on respecting others, especially those who are going out of their way to respect you. Especially, I want to highlight those who are working in restaurants. The wait staff all has to wear face coverings. When wait staff come to your table, put your face covering on as well. They are wearing their face covering to protect the patrons. And patrons, we should do the same and give them the same courtesy. Let's do what's right and protect ourselves and protect others. Let's wear our masks and let's keep our distance and keep washing our hands. Thank you so much. Gracias, Gobernador Pritzker, y buenas tardes a todos. El número de casos en todo el estado está subiendo en las últimas semanas, especialmente en algunos condados y regiones del estado. Muchas personas pueden estar pensando que los números no son tan malos, no son lo que eran un par de meses pasados, y tienen razón. No están al nivel que estaba en abril o mayo, pero están creciendo. Pero si no tomamos más medidas ahora para reducir la propagación del virus, nuestros números van a crecer más y vamos a regresar a donde estábamos hace un par de meses. Si piensa que usar un cubrecara o mantener su distancia no ayuda, está equivocado. Se ha demostrado que estas acciones simples reducen la propagación del virus y bajará el número de casos. Hoy informamos 759 personas recién diagnosticadas con COVID-19, para un total de más de 186,000 casos. Desde ayer se reporta 30 personas con COVID-19 han muerto por un total de más de 7,500 vidas perdidas. Desde anoche, 1,152 personas en Illinois estaban en el hospital con COVID-19. De ellos, 368 pacientes estaban en la unidad de cuidados intensivos y 129 pacientes estaban en ventiladores. En las últimas 24 horas, más de 46,000 pruebas de COVID-19 fueron hechas. Si necesitamos más pruebas Si necesitamos más pruebas y estamos trabajando para aumentar el número de pruebas cada semana. También necesitamos más rastreo de contactos y estamos trabajando con los departamentos de salud locales para contratar más trabajadores. pero también necesitamos más responsabilidad personal y más responsabilidad comunitaria. Eventos como fiestas y graduaciones donde muchas personas se juntan son exactamente cómo se propaga el virus y porque estamos viendo un aumento de casos. No importa qué tipo de evento sea, podrían ser grandes eventos en la comunidad, torneos deportivos, protestas o reuniones familiares. Nadie debe juntarse en grupos fuera de su familia donde no pueden mantener 6 pies de distancia y no usen cubrecaras. No estamos tratando de quitar la libertad de las personas. Se trata de detener la propagación de un virus mortal. COVID-19 es un enemigo invisible con consecuencias muy visibles. Estás cansado de escucharlo y yo estoy cansada de decirlo, pero el virus no está cansado. Está vivo y bien. Desafortunadamente, este virus no parece que se va a ir en cualquier momento. Si sales a comer a un restaurante, ponte su cubrecara cada vez que el servidor llegue a tu mesa. Haz lo correcto. Protégete y protege a los demás. Use su cubrecara, lávese sus manos y mantenga su distancia. El poder está en sus manos. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you. Thank you very much, Doctor. Dr. Ezike and I are joined today by Marco Morales, the Benefit Payment Control Manager at the Illinois Department of Employment Security, to provide an update on the nationwide unemployment fraud scheme investigation that we announced earlier this month. The state unemployment systems across the country continue to work at a feverish pace to manage through a surge of benefit needs related to this pandemic. A level of impact so severe that tens of thousands of Americans are still struggling to access assistance, even as state systems like IDES process an unprecedented number of claims. A poorly designed federal pandemic unemployment assistance program compounded those difficulties by opening the door for a nationwide fraud scandal, as I announced 2 weeks ago. Today, in a continued effort to provide the public all the facts as I have them, we want to offer a 3-part update. 1, why is this fraud happening? 2, what is Illinois doing about it? And 3, how can the public protect their financial security? So let me begin by explaining that the Federal Pandemic Unemployment Assistance Program, or PUA, was passed by Congress in the spring and provides benefits to independent contractors and 1099 workers. This is a brand new program that the federal government rushed to develop and then left each state to create its own separate system. As a result, there were massive holes for illegal fraudsters to steal federal dollars from taxpayers across the country. Since the pandemic began, the U.S. Department of Labor's Office of Inspector General has seen a dramatic increase in the amount of unemployment insurance fraud. Historically, investigations made up 10% of that agency's workload. Today, it's 55%. This includes investigative matters in all 50 states. Because this scheme is nationwide, the number one thing that we've been asked to do here in Illinois is to fully cooperate with federal investigators who have a broader jurisdiction and greater resources than any one state or any local investigative force. Additionally, the Illinois Department of Employment Security is working extensively to provide all necessary information to the Illinois Attorney General, local police, and all engaged prosecutorial forces. On that note, I want to recognize the Attorney General and the entire office that he leads for their tireless work to protect the people of Illinois during this pandemic. In addition to working with law enforcement, IDES is also taking every action to track down and cut off fraudulent claims, reviewing flagged files to identify commonalities and patterns. The highly experienced money launderers who have perpetrated these crimes use the same payment methods that regular filers do. For that reason, IDES can't simply cut off common dispersal mechanisms that also serve as lifelines for innocent users. IDES has identified over 120,000 counts of fraud, 107,000 in the PUA system since its launch in May, and about 14,500 in the standard system since the beginning of March. As a point of reference, IDES has processed more than 2 million claims in 2020. That's nearly 8 times the 271,000 claims that were processed last year. The number of fraudulent claims pales in comparison to the number of Illinoisans in genuine need of assistance. So let's not allow the conversation around unemployment to imply otherwise. I want to ask members of the media to help spread the word that an individual who has not filed an unemployment claim but has received a debit card or an unemployment insurance letter in the mail has likely been a target of this fraud. If that's you, here's what you need to do. Go to the IDES website, that's at ides.illinois.gov. Click on the link that says Report Fraud and Identity Theft, and fill out the contact form located there. You do not need to call the agency if you don't hear back immediately. IDES will get back to you in the order of submission, and in the meantime, there's a link on the IDES fraud reporting page to get your own free credit report. Reporting a case of potential fraud isn't just about helping out the federal and state government. It's about ensuring your own personal financial security. Importantly, individuals who have self-reported and have been properly flagged that they've been a victim of fraud won't have a 1099 form sent to the IRS on their behalf. Otherwise, there will be an additional set of hoops to jump through in a few months' time. Despite the fact that this is a national program that was poorly designed and susceptible to fraud, I can promise Illinoisans that our state government and our state law enforcement authorities will do everything in our power to support anyone who's been affected by this nationwide failure. Before I hand it over to our next speaker on this PUA fraud topic, actually before I take questions, I want to build on the updates that Dr. Ezike provided on COVID-19. Let me begin with some good news today. As of today, Illinois is performing an average of 41,000 tests per day over the last 7 days. And I want to thank our testing team led by Derek Lindblom, without whom this milestone could not have been reached. Unfortunately, the virus rages on. 2 weeks ago, 10 of our 11 Restore Illinois regions had 7-day rolling positivity rates below 5%. That's 10 of 11 at below 5% 2 weeks ago. By last week, that had dropped to only 5 regions below 5%. As of yesterday's data update, we now have just 4 regions with a positivity rate below 5%. I'll remind everyone that the health metrics that will send a region back to tougher mitigations are these. If a region sees 3 consecutive days of a positivity rate averaging 8% or more, or if a region experiences 7 out of 10 days of increasing positivity, plus a sustained 7-day increase in hospital admissions. IDPH and I continue to call on local officials to pay close attention to the data for their communities and, where necessary, step up and impose greater mitigations on a targeted basis to bring down the number of infections and the positivity rate. Otherwise, it will only be a matter of time before the state of Illinois will be forced to step in on a regional basis and impose resurgence mitigations like closing bars, indoor dining, and more to reduce the spread of the virus. Without local action, even more stringent regulations restricting public interaction, or in the extreme another stay-at-home order, might be in your future. We've seen positive examples of responsible action at the local level across the state. Mayors in Chicago and in Springfield have taken sustained proactive actions to emphasize safety. Local health departments in Kankakee and Peoria are stepping up public awareness efforts. The Carbondale City Council unanimously imposed fines to enforce the state's mask mandate. Sangamon County is rolling out fines and permit suspensions for rogue restaurants and bars. Cook County has issued new capacity guidelines for indoor gatherings, fitness facilities, bars, and restaurants. But these interventions are much more effective when paired with collective action among our state's residents. Our goals to save lives and keep people from getting sick far outweigh any personal inconvenience. This is about the people and places that we love. And we need all our residents to take this seriously and to protect ourselves and each other. Statewide, we're seeing two new infection trends that are different than a few months ago. First, the largest increases in cases are occurring among young people, especially between ages 20 and 29. And second, the percentage of the population contracting COVID-19 outside of the Chicago region has dramatically increased. This does not in any way suggest that those are the only two categories of people who are in danger. This virus continues to ravage people of all ages and across the entire state. But young people and those in downstate Illinois are no longer the smallest part among those who are newly infected. Let's be clear, this virus is dangerous, no matter how young you are, because of the long-term damage that it can cause. It's not just a matter of how likely am I to die. Young people who survive COVID-19 report fatigue, breathing problems, and heart issues. What's more, even if your COVID experience seems mild or asymptomatic, you can still spread it to others who are more vulnerable and may end up hospitalized or worse. We all want answers, and we all want certainty. But the frustrating thing about a brand new virus is that doctors simply don't know the extent of its long-term effects because it's only been around for less than a year. They're working on understanding it better and developing therapies and vaccines. But until then, let's do the things that we can control and that will keep you safe. So let me remind everyone, wearing a mask in public places is required. Keep some physical distance and don't indulge others who ignore public health guidance. These are the best things that you can do to keep you and your family and your friends healthy and to keep our economy moving forward. We're all safer and stronger when we're all in Illinois. Thank you, and I'd be happy to take questions from members of the press.
I have a question.
Hi.
Good afternoon.
Good afternoon.
Wasn't the point of the lockdowns and school closures to flatten the curve and reduce hospitalizations?
That was certainly one point of it. Again, the point in the end is to reduce the number of people who get sick and the number of people who die. So all of those things are obviously related to one another. Hospitalizations, people who go into ICU, people who go on ventilators, and then people who die. We're trying to reduce all of those numbers. Yeah.
Right. And then today Mayor Lightfoot said that things won't get back to normal in schools until there's a vaccine and everyone takes one. Is there going to be some state mandate to take a vaccine in order to get our kids back in school?
No, I can't imagine that. What I do think is that once a vaccine is available, I think many, many people will want to get vaccinated. We obviously want to get to herd immunity. We have, for example, with measles vaccine, just to give you an idea, about, I think, 95% coverage in the state of Illinois, people actually getting the measles vaccine, or at least above 90. I actually think we're at 98. Now that I recall, we were at 98% the last time I looked, about 6-8 months ago. And so herd immunity is something you only really can get with vaccines. And so we want people to get vaccinated if it's an effective vaccine, and, you know, and we'll make it available to everyone, especially to those who are vulnerable.
Our goal here, I mean, we can't eradicate COVID.
No, nobody's been able to eradicate the flu or any other. Yep. You can't eradicate it entirely. That's absolutely true. But remember, this is not like any other thing that we've faced in our lifetimes. 155,000 people or so have died in the United States in about a 4-month period. Just to compare, the flu takes about 30 to 50,000 lives per year. So take the 155,000, multiply by 3, that's roughly the death count that could occur, and then look at that in comparison to the flu. We have a vaccine for the flu. We don't have one yet for COVID-19.
Sir, to follow though on Amy's question, when did the goal change as you've been shepherding us through this? When did the goal change from flattening the curve to mitigating all the effects of it in terms of COVID, in terms of hospitalizations and so on?
The goal has always been to keep the people of Illinois healthy and safe. That's always been the goal. We talk about flattening the curve because the very first thing we didn't want to have happen was for hospitals to get overrun, because then you know people are going to die. If you can't get into the hospital because every bed is filled, and we've seen that, by the way, happening in some other states where they literally, in some communities, reach capacity and there is not a hospital bed available, what you know is that if you fill all your hospital beds across the state and all your ICU beds, then you know that the next person that comes in isn't going to be treated, can't get into a room or an ICU bed, or can't get a ventilator. That was the concern very upfront. Now, of course, we've seen that we've been able successfully in the state of Illinois to bring down the case rate, the positivity rate. We've been able to bring down the number of people who've gone into hospitals, the number of people who end up in ICU beds and so on. That's great. We want to keep it there. But remember, we're also trying to stop people from getting sick, right? I mean, do our best that we can as we're looking for a vaccine. Obviously, we're going to continue to have people getting sick. We can see that even in areas where everybody's wearing a mask. What we know, though, is masks do an awful lot to keep down the infection rate. So we're very much encouraging everybody to follow that mitigation, and we're doing the best we can to make sure that the most vulnerable populations in the state of Illinois are protected, as well as everybody else. A mask is a very simple thing for us to ask people to do to reduce the positivity rate.
So in that context, how worried are you about the fall? With schools opening, we can talk about schools in a moment, but with schools opening,
Yeah.
the coming of the flu season itself, the weather
Yes.
getting colder, talk to us about how you look ahead and what you do.
So here's what epidemiologists tell me, and I certainly would turn it over to the doctor if you want a more detailed answer, but this is what I understand. Comorbidities are one of the biggest problems that exist. That is to say, someone who has the flu and gets COVID-19, that can kill you. So we're going to encourage everybody to get a flu vaccine, to go get vaccinated before long in the fall, as soon as the flu vaccine is available. We want to make sure that we're protecting everybody as best we can. The fall does bring with it much more disease, much more sickness. And when you add on top of that COVID-19, that's when you have real problems. And my job here, remember, is to save as many lives, to make sure that we're keeping people from getting sick as best we can. We're doing the best we can. If you really, wanted to try to eradicate it, couldn't happen. You really couldn't. I mean, stay.
So if you shut everything down for a month, it would.
Maybe. I don't know. I mean, when you say shut everything down, I mean, I've only seen that done in a couple of countries where they had absolute control, where they told people to stay in their homes. Only one person can leave the home once a week to go to a grocery store. That's not something that we would do in the United States. And I think that, you saw that our stay-at-home order is much, much different than what happened in other states. But we were successful in the state of Illinois, and frankly in a lot of places around the country, at bringing down the infection rates as a result of a stay-at-home order. I don't want to go back there. I don't want to go back there because we know now some things we didn't really know at the beginning. For example, the CDC was not recommending non-N95 masks at the very beginning, you may recall. They said, the only mask that's effective is an N95 mask. And then a whole bunch of studies were done in other countries as well as in this country, more than 200 of them, which have shown that cloth masks and surgical masks, if everybody wears them, will bring down the infection rate significantly, more than 75%.
Can we talk about schools?
Schools, yeah.
Sure.
CBS obviously going to remote learning.
Yes.
Does that decision, does that change your stance on it? Is it on your radar to say, all right, statewide, we need to go to remote learning?
Here's what I'll tell you. We put out guidance from the Illinois State Board of Education and IDPH and many of the school administrators and superintendents and others, including members of the teachers' unions, were all at the table as we were putting that guidance together. That guidance essentially has some basic requirements. Masking, for example, is a basic requirement for kids to go back to school. Everybody in the school must wear masks. That's part of the guidance. But there's also a whole lot of guidance that is recommended, but you can't tell every school exactly how they should implement it, because each school, frankly, is different. Some schools have larger campuses and fewer kids. Some schools have one school building, and some schools have multiple school buildings. Some of the designs are 50 or 100 years old. Some of them are more modern and have more space available. So these are things that have to be worked out on the local level. How many kids can go to school at any one day in order to keep social distancing? How many buses can run with how many kids packed into a bus? Those are all things that doctors worked on together with educators to try to come up with the right answers to keep everybody safe and healthy. So school districts across the state are making their own decisions. The City of Chicago and its school district made its decision.
But heaven forbid we get back to a May situation, a June situation. You obviously said, at one point this year,
yes,
all right, schools are done.
In the spring, yeah.
In person.
Yeah. That could happen. Yeah, I mean, I don't want it to happen. We're doing everything. You've seen me travel the state, encouraging everybody to wear a mask. I mean, encouraging local city councils and mayors to impose mitigations locally so that we can bring down the infection rate, bring down the positivity rate, because I don't want to go to those statewide more extreme measures. But if the numbers keep rising in Illinois, and as I've said many times, it isn't just that states in like Texas and Florida and California and Arizona have had skyrocketing cases. Around us, all around us, every state that borders Illinois has a higher positivity rate than we do, and there's a lot of travel back and forth between those states and Illinois by people from those states and people from Illinois. And so it's very hard for us to do in Illinois what should have been, they should have imposed in the other states, but we're doing the best we can in Illinois, keeping that positivity rate down. It's just, it's a very difficult thing. If it continues to rise and if we don't keep our positivity rate down, we obviously would have to consider more serious mitigations.
I have a couple questions as pool reporter. Marion Ahern wants to know, does the CPS decision impact fall sports CPS?
That's a decision. Again, we've put out our guidance about sports, fall sports, that's more stringent, regulations that are more stringent than the ones we put out. That's up to local school districts.
Okay, a lot of downstate journalists curious about the Clay County filing, dealing with Representative Darren Bailey. How do you respond to this, the contempt of court?
Well, all I can say is the rulings out of Clay County have been ridiculous. There's no other court that has ruled as they have on the matter that they ruled on. And in fact, there's a judge on Friday who specifically pointed to Clay County and said that the decision by that judge was bereft of any legal analysis. And I think that's accurate.
Okay, last question from Greg Bishop. Tuesday's Restore Illinois Collaborative Commission meeting was canceled because your administration didn't provide anyone from IDS to address questions. Why was no one from IDS made available?
We provided a report to the commission. That's what's required by the law. And we talk regularly with the leaders of that commission and the members of the commission. So they have the ability to hold their meetings anytime, and their reports are there for them to examine and, ask questions around. Yep.
Sorry, I lied. One more question. I promise you. Greg Bishop, this was his top question. I skipped right over it.
Nope.
Can you talk about the overflow hospitals like Vibra Hospital in Springfield? Follow-up, why hasn't the administration told Springfield officials about the status?
Well, I think we've said this actually standing at this podium quite a number of times, that the alternate care sites that we set up early on in this pandemic, we have kept warm. That is to say, they are available for us to use if necessary. Thank goodness we have not needed them. Thank goodness that our hospitalization numbers in the state have not required us to have people stay in those alternate care facilities. But I can't guarantee you that we'll never need them. And certainly as this pandemic rages on and we see the numbers rising all across the nation as well as in the state of Illinois, I worry that we may need to. But I've said that many times from this podium. I think we've been clear to everybody about those facilities being kept available for us if we should need them. Yes,
We've talked
Rick.
before about the fiscal impact and the need for help from the federal government toward all states, Republican and Democrat. But at what point does this become a serious issue with the state being able to that money doesn't come through?
Oh, sure. I mean, let me start with the fact that I'm pleased to say that I've heard that there's some progress on this subject. I was on the call with many of the governors just maybe 2 hours ago. And, we're all monitoring very closely, the National Governors Association monitoring very closely, Republican governors and Democratic governors. Everybody needs this support because none of us want to have to lay off public safety officials, people who keep us safe. Nobody wants to have to lay off the people who provide the services that so many people across the state need, our human services. And so we're all, hoping, praying, making calls about it. But sure, if the Republicans continue to take the stand that they've taken, including the Republicans in the Illinois delegation, against support for local governments and state governments, then we're going to have to make drastic cuts. I mean, I've said that many times. We certainly have to deal with the fact that there is a drop-off of revenue as a result of COVID-19 and this pandemic raging across the country and it affecting the revenue that would otherwise come into the state.
You have agencies looking at certain targets and cuts, and have you spoken to the 5 Republican members of the state's congressional delegation?
I've communicated to them. I haven't spoken individually. I've had calls over the COVID crisis with them to explain what's going on in the state and the challenges for the state. But they're well aware, the whole delegation, Democrats and Republicans, of the challenge that the state of Illinois would face. And I've asked them all for their support for, again, so that we don't have to make the cuts that would affect working families and people in dire need that the state normally would support.
But do you have agencies now?
Of course, and our Office of Management and Budget is always hard at work thinking about where we can make changes, cuts, and so on. I mean, this will be painful, extraordinarily painful, and for a federal government that wants, as we all do, to limit the unemployment damage that's been done across the nation. I mean, really 50 states of layoffs of not just state government workers. It would be layoffs of all the people who sell services and supplies to state government. It would be so many people who do ancillary work in private industry that is beneficial to state government. There would be layoffs really across the board.
We'll do one more question. Can you clarify again, if any part of the state, or if we were to revert back to a phase 3, would that be done region by region, or could it be a statewide, again, across the board decision?
We put a plan in place. It can be found on the IDPH website as well as at DCEO that has the state broken up into 11 regions. And it's really for the purpose of making sure that if there's a region that meets the criteria, the metrics that we set, trips the wire, so to speak, on any of those, that we would impose mitigations on that region. There are multiple that are heading in the wrong direction, as I've said, and I worry about having to impose it in any region, let alone in multiple regions. And could there come a time when the state would need to impose statewide mitigations? As I said a little earlier about schools, there are a number of things that we could do at the statewide level, but you've seen that for months and months, what I've really been looking for is action at the local level, at the county level, at the city level, to make sure that we're keeping our infection rates down and that they're putting in place the enforcement mechanisms and the mitigations that will help us do that. So thank you very much, everybody.
A quick word about Joe Biden. What do you think of him not coming to the Midwest to accept his nomination?
I always love to see Joe Biden. He was here a number of times over the last couple of years, and I got to be with him. And I'm sorry that he's not coming. On the other hand, I completely understand there are lots of people who are not traveling to states that have higher positivity rates because of the danger associated with them. So thank you.
Thank you.
Hey, Michael.
They're gonna, I just texted my friend, they're gonna email you the, is that cool? Yeah. All right, you're welcome.